Ever had someone describe that they have had a period of intense fear, that they have had palpitation, sweating, they are shaking, they have had shortness of breath, and they felt numb, and they have a feeling that something terrible was going to happen during that time? Did they describe that it happened within 20 minutes and that within 10 minutes it was at its highest? This is a panic attack. My name is Nancy Wanjiru Kafiro. I'm a mental health practitioner and a psychologist with Hisia Psychology Consultants. I'd like to request you to like, subscribe, and share our videos. We always give you content every week on mental health issues and even current issues that could affect your mental health. Remember, we would like you to get notified every time we have a release. You see, a panic attack is an exaggeration of your body's normal response to danger. You go through stress and sometimes excitement. So the response to that excitement can cause you to have a panic attack, or the response to that danger can cause you to have a panic attack. You might think that you're losing control or you're having a heart attack. It can happen anytime during the day or sometimes even in your sleep. There are cases where one may develop recurring attack, which then we consider and diagnose as an anxiety disorder. So an occurrence of more than one panic attack is what we call an anxiety disorder, and it can happen because you are going through a major life change. You are undergoing a lot of stress. You could be planning to get married and you are eagerly, and that is causing you to have some sort of anxiety. You could be thinking about getting a child, or you could be thinking about starting a job or even attending an interview. So any lifestyle stressor that causes you to have this exaggerated reaction is what we call a panic attack, and frequency of panic attacks, we call it a major anxiety disorder. Caffeine, use of drugs, and alcohol can increase your chances of having a panic attack or a major anxiety disorder. Research has it that 1 out of 75 people experience a panic disorder. The symptoms of a panic attack often occur for no clear reasons and are not proportional to the level of danger that exists in that environment. Because these attacks cannot be predicted, they can significantly affect your functioning. The symptoms of a panic disorder include a racing heartbeat or palpitation, shortness of breath, feeling like you are choking, dizziness, lightheadedness or nausea, sweating and chills, shaking and trembling. You may have a change in your mental state where you go through derealization or a feeling of unreality. You may have numbness and tingling in your hands and even in your feet. You may have chest pain and tightness or a fear that you might die. What do you do, or how do you help someone who is going through a panic attack? You need to help them, or you need to breathe in slowly and deeply and as gently as you can through your nose and breathe out through your mouth. If you can, close your eyes and focus on your breathing while you count steadily from 1 to 5 as you take in a deep breath, and 1 to 5 as you breathe out. The other thing you can do is to focus on your senses. What is it that you can see, feel, hear, taste, and smell? If you can focus on 3 of those senses, then you will be able to manage your panic attack. After a panic attack, there are 2 things you need to focus on. That is your self-care and then telling and sharing with someone you trust. So self-care is how you take care of your bodily needs, because your body could require some rest. Somewhere quietly, you may need to eat or even have a warm drink to calm your nerves. You may need to share with someone, because when you share, then the feeling of being cared for reduces chances of you getting a panic attack. It is helpful to mention to someone, so that if you have a recurrent attack, they will then know how to help you. The last but the most important thing with an experience of a panic attack is to have a professional therapist work with you. Your therapist will employ CBT, which is very effective because it helps you to challenge the thoughts you're having and the actions that you take, so that you're able to understand and attack and manage that fear that causes you to have the excess reaction.